What if I told you that right now, your body might be sending you a warning signal about a stroke that could happen weeks from today? Every year, nearly 800,000 Americans suffer a stroke. That's one every 40 seconds. But here's what most people don't know. Your body often tries to warn you up to 30 days before it happens. The tragic part? These warnings are so subtle that many people completely dismiss them as stress or aging. Today, I'm going to show you the specific early signs like unexplained fatigue and how recognizing them could save your life. The first warning might be hiding in numbers you check every day. Blood pressure spikes that doctors fear most. Your blood pressure readings might reveal patterns that emergency doctors consider more dangerous than any single high number. Most people think a consistent reading of 140/90 signals trouble, but recent research from the American Heart Association shows that wild swings in your blood pressure actually double your stroke risk compared to steady high numbers. When your readings jump from 120/80 in the morning to 160/95 by afternoon, then drop back down by evening, your arteries endure repetitive stress that steady high pressure never creates. The most dangerous pattern doctors now watch for is called morning surge hypertension. This happens when your blood pressure spikes dramatically within the first hour of waking up. We're talking about increases of 30 to 40 points in your systolic pressure that occur almost every morning. Your body naturally raises blood pressure when you wake to get your circulation moving, but when this surge exceeds 140/90 consistently, it creates microscopic tears in your artery walls. These tears become collection points for cholesterol and blood clots, setting the stage for a stroke weeks later. What makes these fluctuations so deadly is how they fool both patients and doctors. A person might have a normal reading of 125/80 at their doctor's appointment, but their home monitor shows spikes to 175/105 during stressful moments or physical activity. These sudden spikes create what researchers call pressure storms inside your arteries. Each storm weakens the blood vessel walls a little more, like repeatedly inflating and deflating a balloon until it finally bursts. Your damaged arteries actually send out distress signals through these blood pressure changes, but most people write them off as stress or caffeine effects. When your arteries start to harden and narrow, they can't expand and contract normally to accommodate blood flow changes. This creates erratic pressure readings that seem to come from nowhere. The pressure spikes aren't random, though. They follow specific patterns that predict stroke risk with frightening accuracy. Emergency doctors focus on identifying dangerous blood pressure variability when someone comes in with stroke concerns. Large swings in your readings harm arteries through repetitive stress that damages vessel walls over time. This variability creates more arterial damage than steady high pressure because your blood vessels never get a chance to adapt or heal between pressure surges. Home blood pressure monitoring has become essential because these dangerous patterns only show up when you take multiple readings throughout the day. The new guidelines recommend checking your pressure at 4 specific times: immediately upon waking, mid-morning, late afternoon, and before bed. You need to take these readings for at least 2 weeks to identify the patterns that predict stroke risk. Single readings at the doctor's office miss the fluctuations that matter most. The physical symptoms that accompany these dangerous blood pressure patterns are unmistakable once you know what to look for. Pulsing headaches that match your heartbeat indicate that your brain arteries are struggling with pressure changes. These aren't typical tension headaches. They throb with each pulse and often get worse when you bend over or strain. Chest tightness that comes and goes throughout the day signals that your heart is working overtime to pump blood through narrowed arteries. Vision flickering, where your sight briefly dims or you see spots, happens when pressure surges temporarily reduce blood flow to your optic nerves. When your blood pressure readings enter the danger zone, meaning morning surges above 140/90 or wild swings throughout the day, you need immediate action. First, sit down and take 3 deep breaths, waiting 2 minutes between each reading to confirm the numbers. If the high reading persists, avoid caffeine, reduce sodium intake for the rest of the day, and engage in light physical activity like walking. However, if you're experiencing chest pain, severe headache, or vision changes along with high readings, you need emergency care immediately. The breakthrough in stroke prevention comes from new, rapid-acting medications that can reduce stroke risk within hours of dangerous blood pressure spikes. These medications work differently from traditional blood pressure drugs because they target the specific mechanisms that cause pressure storms. ACE inhibitors combined with calcium channel blockers can stabilize blood pressure fluctuations within 24 hours, giving your arteries time to heal from the damage caused by repeated pressure spikes. What's particularly concerning is how quickly these blood pressure patterns can cause permanent arterial damage. When your arteries experience repeated pressure storms over just 2 to 3 weeks, the damage becomes irreversible. The artery walls develop scar tissue that makes them permanently stiff and narrow. This creates a vicious cycle where even normal blood pressure becomes dangerous because the damaged arteries can't handle any pressure changes. The most dangerous misconception people have is thinking that blood pressure medication alone will protect them from stroke. While medication helps control the numbers, it doesn't repair the arterial damage that irregular pressure patterns create. You need to address the underlying causes of pressure fluctuations, which often include sleep apnea, chronic stress, dehydration, and medication interactions. Many people take multiple medications that unknowingly create blood pressure swings throughout the day. Sleep patterns play a crucial role in these dangerous blood pressure fluctuations. When you don't get deep sleep, your body produces more stress hormones that cause morning blood pressure surges. People who sleep less than 6 hours per night or who have interrupted sleep show the most dangerous pressure patterns. The connection between poor sleep and stroke risk is so strong that doctors now consider sleep quality as important as blood pressure numbers when assessing stroke risk. Understanding these blood pressure patterns could save your life because they give you weeks of warning before a stroke occurs. The key is recognizing that steady numbers aren't enough. You need to watch for the fluctuations and patterns that reveal arterial damage. But blood pressure changes aren't the only warning your body sends. Sometimes the most important signal comes disguised as something completely different. A type of exhaustion that no amount of rest seems to fix. The exhaustion that signals brain trouble. This bone-deep exhaustion that no amount of rest can cure represents one of the most overlooked warning signs of an impending stroke. You can sleep for 12 hours straight, drink multiple cups of coffee, and still feel like someone drained all the energy from your body. This isn't the tired feeling you get after a long day at work or staying up too late. This is persistent, unexplained fatigue that settles into your core and refuses to leave no matter what you do to fight it. Recent neurological research has uncovered why this happens and why it's such a critical warning sign. When blood flow to your brain becomes restricted weeks before a stroke, your brain tissue doesn't get the oxygen and nutrients it needs to function properly. Think of your brain like a high-performance engine that suddenly isn't getting enough fuel. It can still run, but it has to work much harder to accomplish the same tasks, leaving you feeling completely drained even from simple mental activities like reading or having a conversation. This type of exhaustion combines overwhelming mental and physical fatigue that creates a perfect storm of feeling awful. Thinking feels like you're walking through thick mud, where every thought requires tremendous effort and concentration becomes nearly impossible. Physical weakness affects your muscles and coordination, making you feel unsteady and clumsy even during routine activities. When these symptoms hit you simultaneously, the exhaustion becomes overwhelming and unmistakable. You might find yourself sitting down frequently during activities that never tired you before, like folding laundry or preparing meals. Simple conversations become exhausting because your brain struggles to follow the thread of discussion and formulate responses. You feel like you need to concentrate intensely just to understand what people are saying to you. and by the end of the conversation, you're mentally drained. Mini strokes, which doctors call transient ischemic attacks, or TIAs, often announce themselves through episodes of unexplained exhaustion that come and go over several weeks. During a TIA, blood flow to part of your brain gets temporarily blocked, usually for just a few minutes. While the blockage resolves quickly, it leaves your brain cells damaged and struggling to recover. This creates waves of exhaustion that seem to appear randomly, but actually follow the pattern of these mini strokes occurring in your brain. The timing of this TI-related exhaustion provides crucial clues about what's happening. You might feel completely normal when you wake up, then suddenly feel overwhelmed with fatigue around. Mid-morning, the exhaustion might last for several hours, then gradually improve by evening, only to return again a few days later. This pattern of exhaustion that comes in waves over weeks indicates that your brain is experiencing repeated episodes of reduced blood flow. When fatigue becomes a stroke warning sign, it specifically affects the brain regions that control alertness and energy regulation. The reticular activating system, located in your brainstem, normally keeps you awake and alert throughout the day. When blood flow to this area becomes restricted, maintaining normal alertness requires enormous effort. The thalamus, which acts like a relay station for sensory information, also struggles when blood flow decreases, making you feel disconnected from your surroundings and mentally foggy. What makes this stroke-related exhaustion particularly dangerous is how it resists all the usual remedies for tiredness. You can drink coffee until your hands shake, but the mental fog persists. You can take naps throughout the day, but you wake up feeling just as drained as before. You can go to bed early and sleep deeply, but morning brings the same overwhelming fatigue. This resistance to improvement is your brain's way of telling you that the problem isn't lack of sleep or too much caffeine. It's lack of adequate blood flow. The exhaustion comes with other symptoms that make the overall picture particularly concerning. Difficulty concentrating becomes so severe that you can't follow the plot of a television show or remember what you read in a paragraph. Memory lapses start affecting your daily routine. You forget appointments, lose track of conversations mid-sentence, or can't remember why you walked into a room. Coordination issues make you bump into door frames, drop things more frequently, or feel unsteady when walking, especially when you're tired. Doctors have developed specific questions to differentiate stroke-related fatigue from other causes of exhaustion. They ask about the pattern of fatigue. Does it come in waves or remain constant throughout the day? They inquire about cognitive symptoms. Are you having trouble finding words or following conversations? They explore physical coordination. Are you dropping things or feeling unsteady more often than usual? They investigate the timeline. Has this type of exhaustion been building over weeks rather than days? The medical evaluation also focuses on what doesn't improve the fatigue. If rest, sleep, reduced stress, and caffeine avoidance don't help, doctors become much more concerned about brain-related causes. They also ask about morning symptoms specifically, since stroke-related fatigue often feels worst when you first wake up, before your brain has had time to compensate for reduced blood flow overnight. New diagnostic tools can detect the brain blood flow issues that cause this type of exhaustion before permanent damage occurs. Advanced MRI techniques can measure blood flow velocity in specific brain arteries, identifying areas where circulation has become sluggish weeks before a stroke. Transcranial Doppler ultrasound can detect narrowed arteries that aren't supplying adequate blood to brain regions controlling energy and alertness. Blood tests can also reveal markers of brain stress that accompany this type of exhaustion. Elevated levels of certain proteins indicate that brain cells are struggling with inadequate oxygen supply. Inflammation markers show whether the blood vessels supplying your brain are under attack from immune system activation. These blood markers can confirm that exhaustion is related to brain blood flow rather than other medical conditions. Recognizing this exhaustion pattern can prevent permanent brain damage because it provides weeks of warning before a major stroke occurs. The brain tissue affected during this early warning period can often recover completely if blood flow gets restored quickly. However, if the warning signs get ignored and blood flow continues to decline, the same brain regions that initially caused exhaustion will suffer permanent damage during a stroke. Regular monitoring and immediate doctor follow-up when this type of persistent fatigue appears can make the difference between recovery and permanent disability. But exhaustion isn't the only way your body warns you about stroke risk. Sometimes the most telling signs appear in places you check every day without realizing what you're seeing. Vision changes your eyes can't hide. Your eyes reveal warning signs that most people mistake for minor annoyances or aging. While you're blaming those strange vision changes on computer screen time or needing new glasses, your eyes might actually be sending urgent warnings about a stroke that could happen within the next month. Most people dismiss fleeting vision problems as normal signs of aging or eye strain, but these seemingly minor changes often represent the first visible evidence that your brain's blood supply is in serious trouble. Recent ophthalmological research has revolutionized how doctors understand the connection between vision changes and stroke risk. Scientists have identified specific vision patterns that can predict a stroke within 30 days with remarkable accuracy. These patterns aren't random vision problems. They follow predictable sequences that reveal exactly what's happening inside your brain's blood vessels weeks before a major stroke occurs. The breakthrough came when researchers realized that the eyes act as windows into brain circulation, showing problems that brain scans might miss. The vision changes that signal blocked arteries are subtle but distinct once you know what to look for. Fleeting blind spots appear as dark patches in your vision that last anywhere from a few seconds to several minutes, then disappear completely. These aren't the typical floaters that drift across your field of vision. They're fixed spots that block your sight in specific areas. Brief double vision episodes make you see two images of the same object, usually lasting less than an hour before your vision returns to normal. Temporary visual distortions cause straight lines to appear wavy or bent, text to look blurry despite clear glasses, or colors to seem washed out or overly bright. These vision changes happen because your optic nerve is incredibly sensitive to blood flow disruptions. When arteries supplying oxygen to your eyes or brain become narrowed or blocked, even temporarily, your optic nerve responds immediately by creating visual symptoms. The optic nerve requires a constant supply of oxygen-rich blood to function properly, more so than almost any other nerve in your body. When blood flow drops even slightly, the nerve cells start malfunctioning, creating the warning signs that appear weeks before a stroke. Your optic nerve connects directly to multiple areas of your brain, which means vision problems often indicate that brain blood flow is compromised in several locations simultaneously. When you experience vision changes, it suggests that the same arterial problems affecting your eyes are also affecting brain regions responsible for movement, speech, and thinking. This connection explains why vision changes are such powerful predictors of stroke risk. They reveal widespread circulation problems that haven't yet caused obvious brain symptoms. Emergency physicians have learned to identify specific visual symptoms as critical red flags that require immediate intervention. Sudden peripheral vision loss, where you lose sight in the outer edges of your visual field, indicates that blood flow to specific brain regions has been severely compromised. Visual field cuts, where you lose vision in distinct patterns like the left half of your visual field or the upper quadrants, suggest that particular brain arteries are becoming blocked or have already experienced mini-strokes. These emergency vision symptoms differ from gradual vision changes because they appear suddenly and affect specific patterns rather than general blurriness. A visual field cut might make you unable to see anything to your left side, even though your central vision remains crystal clear. Peripheral vision loss might leave you with tunnel vision, where you can see straight ahead but lose awareness of objects or people approaching from the sides. These patterns tell emergency doctors exactly which brain arteries are in trouble. The timing and triggers of vision changes provide crucial diagnostic clues that help doctors identify stroke risk. Many people notice these vision problems during specific activities like reading, watching television, or using computers, activities that require sustained visual focus and can stress already compromised blood vessels. Others experience vision changes at particular times of day, often in the morning when blood pressure naturally surges, or in the evening when circulation slows down. Physical position changes can also trigger vision symptoms when blood flow is already compromised. Standing up quickly, bending over, or turning your head rapidly might cause brief vision loss or distortion. These position-related vision changes indicate that your brain's blood supply is so marginal that even minor circulation changes cause symptoms. The pattern of when and how vision changes occur helps doctors determine how urgently intervention is needed. New eye imaging technology can detect stroke risk by examining the tiny blood vessels in your retina. These retinal blood vessels are the only blood vessels in your body that doctors can see directly without surgery. Advanced retinal photography can reveal narrowed arteries, small hemorrhages, or areas where blood flow has been disrupted. This technology can identify people at high stroke risk even when they haven't noticed any vision changes yet. When you experience any vision changes that could indicate stroke risk, the time frame for seeking medical attention depends on the severity and duration of symptoms. If vision loss is severe, affects large areas of your visual field, or comes with other symptoms like weakness or speech problems, you need emergency care immediately. For less severe but recurring vision changes, you should see a doctor within 24 to 48 hours to assess stroke risk and begin preventive treatment. Different types of vision problems predict different types of strokes, giving doctors valuable information for treatment planning. Double vision and coordination problems often indicate strokes affecting the brainstem or cerebellum. Visual field cuts typically predict strokes in specific brain regions that control vision processing. Temporary blindness or severe vision loss suggests problems with the arteries supplying the visual cortex or optic nerves. Ignoring vision warnings creates a dangerous cascade that can lead to permanent sight loss and brain damage within weeks. When your optic nerve isn't receiving adequate blood flow, it indicates that other brain regions are also struggling with reduced circulation. The same arterial problems causing vision changes are simultaneously damaging brain tissue responsible for movement, speech, and thinking. But vision changes aren't the only warning signal your brain sends when blood vessels are in crisis. Sometimes the most urgent alarm comes in the form of pain, so severe it feels like your skull might split open. Headaches that scream emergency. These headaches represent your brain's most urgent alarm system, delivering pain so intense it feels like lightning striking inside your skull. This isn't the dull ache you get from stress or the throbbing pain that builds gradually throughout the day. This is a headache that reaches maximum intensity within seconds and refuses to respond to any pain medication you throw at it. When this type of headache hits, you're experiencing your brain's final desperate warning before a hemorrhagic stroke tears through your blood vessels. Recent neurological studies have mapped these warning headaches with remarkable precision. Researchers tracked thousands of hemorrhagic stroke patients and discovered that 78% experienced distinctive headache patterns in the weeks leading up to their strokes. These weren't random headaches scattered throughout the month. They followed specific escalating patterns that predicted brain bleeding with startling accuracy. The most dangerous pattern involves headaches that increase in frequency and intensity over a 2 to 3 week period, building toward the catastrophic event. What makes these headaches different from any pain you've experienced before is their sudden onset and thunderclap intensity. Normal headaches build gradually, starting as mild discomfort and slowly increasing over minutes or hours. Stroke warning headaches explode into existence, reaching peak intensity within 60 seconds of onset. Patients describe the sensation as being hit in the head with a baseball bat or having their skull crushed in a vice. The pain is so severe and immediate that it stops people in their tracks, forcing them to grab their heads and often causing them to cry out or collapse. The location patterns of these headaches provide crucial information about which blood vessels are failing. Headaches concentrated at the back of the head, particularly at the base of the skull, where it meets the neck, often indicate weakness in the vertebral arteries that supply blood to the brainstem. Sharp, stabbing pains on one side of the head suggest problems with the carotid arteries or middle cerebral arteries on that side. Headaches that feel like pressure building behind the eyes indicate increased intracranial pressure from blood vessel swelling or small bleeds that haven't yet caused a full stroke. These warning headaches occur because weakened blood vessels create dangerous pressure changes inside your skull weeks before they finally rupture. When artery walls become thin and fragile, they start to bulge outward, forming what doctors call aneurysms. These bulging areas create turbulent blood flow that generates pressure waves throughout your head. Each heartbeat sends a shock wave through the weakened vessel, creating the intense, pulsing pain that characterizes these warning headaches. Along with the excruciating head pain, these stroke warning headaches bring a constellation of symptoms that make them unmistakably dangerous. Neck stiffness develops because blood or fluid irritates the membranes covering your brain and spinal cord. This isn't the mild neck tension you get from sleeping wrong. It's severe rigidity that makes turning your head extremely painful or impossible. Light sensitivity becomes so intense that even dim indoor lighting feels like staring into the sun, forcing people to seek dark rooms and wear sunglasses indoors. The nausea patterns associated with these headaches are particularly telling. Unlike typical headache-related nausea that comes and goes, stroke warning headaches trigger persistent, violent nausea that doesn't improve with anti-nausea medications. The vomiting often occurs without warning and provides no relief from the head pain. This happens because the pressure changes affecting your brain also disrupt the balance centers in your inner ear and the nausea control centers in your brainstem. What makes these headaches particularly frightening is their complete resistance to typical pain medications. Over-the-counter pain relievers like ibuprofen, acetaminophen, or aspirin provide no relief whatsoever. Even prescription migraine medications fail to touch the pain. This resistance occurs because the headache isn't caused by inflammation or muscle tension that these medications can address. It's caused by dangerous pressure changes and blood vessel damage that require emergency medical intervention. Physical activity makes these headaches dramatically worse, which is the opposite of what happens with tension headaches or some migraines that improve with gentle movement. Any activity that increases blood pressure, including walking, climbing stairs, or even standing up quickly, intensifies the pain to unbearable levels. The headaches also worsen when you lie down flat as the position changes, increase pressure inside your skull. Emergency doctors have developed specific questions to differentiate stroke-related headaches from other severe headache types. They ask about onset timing. Did the headache reach maximum intensity within 1 minute? They inquire about pain characteristics. Is this the worst headache you've ever experienced? They explore accompanying symptoms. Are you experiencing neck stiffness, light sensitivity, or persistent vomiting? They investigate medication response. Have pain relievers provided any relief whatsoever? The most important thing to understand about these headache patterns is that immediate medical attention can prevent fatal brain hemorrhages. When caught during the warning phase, doctors can use advanced procedures to strengthen weakened blood vessels before they rupture. Endovascular coiling can seal off aneurysms, while surgical clipping can prevent blood vessel rupture. However, once the vessel actually bursts and causes a hemorrhagic stroke, the treatment options become much more limited and the outcomes far worse. Time becomes the critical factor because these warning headaches indicate that blood vessel failure is imminent. Each severe headache episode represents another step closer to catastrophic bleeding that can cause permanent brain damage or death within minutes. But while these headaches signal immediate danger in your brain's blood vessels, other warning signs can be body weakness that predicts disaster. Muscle weakness might be developing in your body right now so gradually that you're attributing it to sleeping wrong, carrying heavy groceries, or simply getting older. You might notice your smile appears slightly uneven in the mirror one morning, or your left arm feels unusually heavy when reaching for something on a high shelf. These seemingly minor changes represent your brain's early warning system, signaling that oxygen-starved tissue is beginning to malfunction weeks before a major stroke occurs. Recent stroke research has mapped how weakness progresses from barely noticeable changes to complete paralysis, identifying specific stages that unfold over days and weeks before catastrophic brain damage. The progression typically begins in facial muscles, then spreads to the arm, and finally affects the leg on the same side of the body. This sequence follows the exact pathway of brain blood flow disruption, providing a precise roadmap for predicting when and where a stroke will strike. Different weakness patterns signal specific types of impending strokes. Facial weakness beginning around the mouth and gradually affecting the entire side of the face indicates problems with the middle cerebral artery. Arm weakness starting in fingers and hands, then spreading upward, suggests blockages in smaller brain arteries controlling fine motor movements. Leg weakness beginning with a slight limp or tendency to drag one foot points to problems in the anterior cerebral artery territory. These patterns occur because brain blood flow disruption creates cellular damage affecting different brain regions in a predictable sequence. When an artery becomes narrowed or blocked, the brain tissue it supplies doesn't receive adequate oxygen and nutrients. The cells don't die immediately but enter a distressed state where they function at reduced capacity. This creates the subtle weakness people experience weeks before major strokes occur. Brain regions controlling movement are particularly sensitive to blood flow changes because they require enormous energy to function properly. When these areas receive reduced circulation, they malfunction in ways that create detectable weakness patterns. The motor cortex begins sending weaker signals to muscles throughout the body, while the basal ganglia struggles to maintain normal muscle tone and coordination. Facial drooping represents one of the earliest and most reliable warning signs of impending stroke. This weakness typically begins around the corner of the mouth, making one side of a person's smile appear lower than the other. The drooping progresses gradually over days or weeks, affecting the ability to close one eye completely, raise one eyebrow, or puff out cheeks symmetrically. Many people first notice this when brushing their teeth and realizing they can't hold water in their mouth properly, or when drinking and liquid leaks from one side. Arm drift occurs when the brain can no longer maintain normal muscle tone and coordination in one arm. During early stages, this manifests as difficulty performing fine motor tasks like buttoning shirts, writing clearly, or picking up small objects. The affected arm gradually becomes weaker and less coordinated, eventually developing a tendency to drift downward when both arms are raised simultaneously. This drift happens because brain signals controlling arm position and strength become progressively weaker as blood flow decreases. Leg instability creates walking difficulties that gradually worsen over time. Initially, people might notice they're stumbling more frequently or feeling unsteady on uneven surfaces. One leg might feel slightly heavier than the other, or they might unconsciously favor one side when standing or walking. As weakness progresses, the affected leg begins to drag slightly when walking, and people develop a characteristic limp that worsens throughout the day. The updated FAST assessment protocol provides simple tests anyone can perform at home to detect these dangerous weakness patterns. The facial test involves asking someone to smile while observing whether both sides of their mouth move equally. For the arm test, have the person close their eyes and hold both arms straight out for 10 seconds, watching carefully to see if one arm drifts downward or turns inward. Additional tests include grip, strength comparison, and balance assessment to catch weakness patterns the original protocol might miss. What makes this weakness particularly dangerous is how it comes and goes during the early warning period. People might experience noticeable weakness for several hours, then have it completely disappear for days or weeks. This intermittent pattern occurs because mini-strokes temporarily block blood flow to brain regions, causing weakness while blockage persists, then allowing normal function to return when circulation is restored. However, each episode indicates brain tissue damage, and episodes typically become more frequent and severe as major strokes approach. Mini-strokes create temporary weakness that serves as the final warning before permanent damage occurs. During these events, blood flow to part of the brain gets blocked for minutes to hours. While blockage eventually clears and normal function returns, it leaves behind microscopic areas of brain damage that accumulate over time. Each mini-stroke makes the next one more likely and severe, creating dangerous progression toward major strokes causing permanent paralysis. The timing patterns of weakness provide crucial information about stroke risk urgency. Weakness occurring daily or several times per week indicates extremely high stroke risk within the next 48 to 72 hours. Episodes lasting longer than 30 minutes suggest brain tissue is experiencing severe oxygen deprivation and may not recover completely. Weakness affecting multiple body parts simultaneously indicates widespread brain blood flow problems requiring immediate emergency intervention. Recognizing these weakness patterns immediately creates opportunities for interventions that can preserve normal function and prevent permanent disability. When weakness is caught during the warning phase, doctors can use blood-thinning medications to dissolve small clots, blood pressure medications to improve circulation, or surgical procedures to open blocked arteries. However, once weakness becomes permanent after major strokes, treatment options become limited to rehabilitation rather than prevention, and full recovery becomes much less likely. But physical weakness isn't the only way your brain signals impending crisis. Sometimes the most telling warnings emerge through something you do every day without thinking about it. Speech problems that signal brain crisis. Your speech patterns might be revealing warning signs that you and your family are starting to notice but haven't yet connected to stroke risk. Maybe you struggled to find a common word yesterday that you've used thousands of times before, or your sentences seem to trail off mid-thought, leaving everyone confused about what you were trying to say. Most people experiencing these early speech changes blame them on being tired after a long day or stressed about work deadlines. What they don't realize is that their brain's language centers are sending out distress signals weeks before a stroke occurs. Recent neurolinguistic research has identified specific speech pattern changes that predict stroke with remarkable precision, often appearing 3 to 4 weeks before the actual event. Scientists analyzed thousands of hours of recorded conversations from stroke patients and discovered that subtle alterations in speech follow predictable patterns that can be measured and tracked over time. These changes aren't random communication difficulties. They represent systematic breakdowns in how the brain processes and produces language when blood flow to critical areas becomes compromised. The research revealed that speech problems begin in the brain's language networks long before people notice obvious communication difficulties. When blood flow to these regions decreases gradually over weeks, brain cells start malfunctioning in ways that create detectable changes in speech patterns. Advanced computer analysis can now identify these changes with accuracy rates exceeding 87%, making speech analysis one of the most reliable early warning systems for stroke prediction. Word-finding difficulties represent the earliest and most common speech warning sign of approaching stroke. This problem begins as occasional pauses when trying to recall familiar words during normal conversation. You might find yourself stopping mid-sentence, knowing exactly what you want to say but unable to access the specific word you need. Initially, these episodes last only a few seconds, and you can usually find alternative words to express your thoughts. However, as stroke risk increases, the word-finding problems become more frequent and severe. The progression of word-finding difficulties follows a predictable pattern that reveals which brain areas are being affected. Problems recalling nouns, especially names of objects and people, indicate issues with the temporal lobe language areas. Difficulty finding verbs and action words suggests problems with frontal lobe language regions. When both types of words become hard to access, it indicates widespread language network dysfunction that significantly increases stroke risk within the following weeks. Slurred consonants create another distinctive early warning pattern that differs significantly from simple mumbling or speaking too quickly. This problem occurs when the brain struggles to coordinate the precise muscle movements required for clear speech production. Consonants like P, B, T, and D require exact timing and coordination between your tongue, lips, and breathing. When brain areas controlling these movements receive inadequate blood flow, consonant production becomes inconsistent and unclear. The slurring typically begins with the most complex consonant sounds that require the most precise muscle coordination. Words containing STR, THR, or SPR combinations become increasingly difficult to pronounce clearly. People often notice this first when they're tired or speaking quickly, but gradually the slurring becomes apparent even during slow, careful speech. Family members usually detect this change before the person experiencing it realizes their speech has become less clear. Sentence structure breakdown represents the most concerning early speech warning sign because it indicates problems with the brain's executive language functions. This issue causes people to lose the ability to organize words into grammatically correct sentences. Simple sentences become choppy and incomplete with missing connecting words like and, but, or because. Complex sentences become impossible to construct, forcing people to communicate using only short, basic phrases. Different stroke types create distinct speech warning patterns because they affect different brain language centers. Strokes affecting the left middle cerebral artery typically cause problems with speech production while leaving comprehension relatively intact. Strokes in the posterior circulation often affect both speech production and understanding simultaneously. Recognizing these patterns helps medical professionals identify which brain areas are at risk and choose the most appropriate preventive treatments. New smartphone apps can analyze speech patterns to detect early stroke risk with remarkable accuracy. These apps use artificial intelligence to identify subtle changes in pronunciation, word choice, sentence structure, and speaking rhythm that indicate brain blood flow problems. Users record themselves reading standard passages or having conversations, and the apps compare these recordings to baseline patterns to detect concerning changes. Speech problems related to stroke risk characteristically worsen under stress or fatigue because these conditions increase the brain's oxygen and energy demands. When brain language areas are already struggling with reduced blood flow, additional stress pushes them beyond their capacity to function normally. This creates a diagnostic pattern where speech problems become more noticeable during challenging conversations, when speaking in noisy environments, or when discussing complex topics. Family members and close friends often notice these subtle speech changes before the person experiencing them becomes aware of any problems. Loved ones might comment that someone seems to be searching for words more often, speaking less clearly than usual, or having trouble following complex conversations. These observations from people who know someone's normal speech patterns are incredibly valuable for early stroke detection. Early speech therapy interventions can prevent progression to severe communication disabilities when warning signs are recognized promptly. These interventions focus on maintaining and strengthening language networks, while medical treatments address underlying blood flow problems. Intensive language exercises can encourage brain plasticity and help preserve communication abilities even when some brain areas are compromised. Recognizing speech changes immediately creates opportunities to preserve language function and prevent permanent communication disabilities. But speech problems aren't the only subtle warning signs your brain sends when blood flow becomes compromised. Sometimes the most telling signals appear through something as simple as your ability to walk across a room without stumbling. Balance issues that predict brain damage. That stumble on your way to the kitchen might reveal more than simple clumsiness. It could signal that blood flow to your brain's balance centers is becoming dangerously compromised weeks before a stroke occurs. Most people dismiss balance problems as normal aging, wrong footwear, or inner ear issues, never realizing these subtle changes often represent the first detectable signs that critical brain regions aren't receiving adequate oxygen and nutrients. Recent neurological research has revolutionized understanding of how balance problems predict stroke risk. Scientists tracked thousands of patients for months before their strokes and discovered that balance issues appeared in 64% of cases, an average of 23 days before the actual event. The problems were particularly pronounced when the cerebellum was involved, the brain region at the back of your skull that coordinates balance, spatial awareness, and smooth movement. When blood flow to this area becomes even slightly restricted, it creates detectable changes in how you navigate through space. These findings completely changed how doctors understand stroke development timelines. Balance problems don't appear randomly in the weeks before strokes. They follow specific patterns revealing exactly what's happening inside your brain's circulation system. People experiencing unexplained balance issues showed stroke rates 340% higher than those with normal balance, making these symptoms among the most reliable predictors of impending brain damage. Unexplained dizziness represents one of the most common early warning signs, but differs significantly from occasional lightheadedness everyone experiences. Stroke-related dizziness feels like the world is spinning or tilting even when sitting perfectly still. This vertigo sensation lasts anywhere from minutes to hours and often occurs without obvious triggers like standing quickly or sudden head movements. The dizziness frequently worsens when focusing on specific objects or in crowded, visually complex environments. Coordination difficulties begin as subtle movement changes that gradually become more noticeable over several weeks. You might bump into door frames you've walked through thousands of times, or struggle judging distances when reaching for objects. Simple tasks like pouring coffee or inserting keys become surprisingly challenging because your brain struggles coordinating the precise movements required. These coordination problems typically affect both body sides, but may be slightly worse on one side, depending on which brain areas receive reduced blood flow. Spatial disorientation creates confusion about where your body exists relative to surroundings. This manifests as difficulty navigating familiar spaces like your home or workplace, feeling unsure about space needed to walk safely through doorways, or trouble judging step and curb heights. Some people describe feeling like they're walking on a gently rocking boat, even on solid ground. This disorientation occurs because brain regions processing spatial information aren't receiving adequate oxygen and nutrients. These balance problems develop because reduced blood flow to brain balance centers creates cellular dysfunction, affecting how your nervous system processes movement and position information. The vestibular nuclei in your brainstem integrate information from inner ears with visual and muscle feedback, becoming hypersensitive to blood supply disruptions. When these nuclei malfunction, they send conflicting signals to muscles about body position and movement, creating balance problems that serve as stroke warnings. The cerebellum requires more blood flow per gram of tissue than almost any other brain region because it contains such dense nerve cell concentrations. When cerebellar blood flow decreases, even slightly, it immediately affects the precise calculations this region performs to maintain balance and coordination. The cerebellum processes information from inner ears, eyes, and muscles thousands of times per second to keep you balanced. When this processing becomes impaired due to reduced blood flow, resulting balance problems provide clear evidence of elevated stroke risk. Simple balance tests can detect stroke risk at home using protocols anyone can perform safely. The tandem walk test involves walking heel to toe in a straight line for 10 steps with eyes open, then repeating with eyes closed. People at stroke risk often show dramatic differences between eyes open and eyes closed performance. The single leg stand test requires standing on one foot for 30 seconds without support. Inability to maintain balance for at least 20 seconds indicates concerning dysfunction, warranting medical evaluation. Position changes and specific movements often trigger balance problems when stroke risk is elevated, providing crucial diagnostic clues about affected brain areas. Balance problems occurring primarily when standing from sitting indicate issues with blood pressure regulation and brain blood flow. Dizziness triggered by head movements suggests problems with vertebrobasilar arteries supplying the brainstem and cerebellum. Balance issues worsening in low light conditions indicate visual processing areas aren't receiving adequate blood flow to compensate for reduced balance system function. The most concerning symptom combinations indicating highest stroke risk include dizziness combined with coordination problems and visual changes, balance issues accompanied by one-sided weakness, and spatial disorientation occurring with speech difficulties or confusion. When any two symptom categories appear together, particularly if worsening over days or weeks, immediate medical evaluation becomes essential because stroke risk reaches dangerous levels. Ignoring balance changes creates dangerous cascades, extending beyond stroke risk itself. Balance problems dramatically increase fall risk, and falls can cause injuries preventing people from seeking prompt medical attention when stroke symptoms develop. Additionally, balance problems often indicate blood flow issues affecting multiple brain regions simultaneously, meaning other stroke warning signs are likely developing concurrently but may not yet be obvious. But balance isn't the only system that sends early warnings when your brain faces danger. Sometimes the most subtle yet telling signs appear in how clearly you can think and remember even the simplest things. Cognitive changes that forecast catastrophe. Memory lapses that happen repeatedly over several weeks might reveal urgent warnings about approaching stroke risk that most people dismiss as normal aging or stress. When you walk into a room and completely forget why you went there multiple times per day, or struggle to recall conversations from hours earlier, your brain's thinking centers could be struggling with reduced blood flow. These cognitive warning signs often appear 3 to 4 weeks before strokes occur, creating opportunities for prevention when recognized early. Recent cognitive research has revolutionized understanding of how mental changes predict different types of strokes. Scientists analyzing data from over 20,000 participants across 11 countries discovered that cognitive decline patterns can identify stroke risk with remarkable precision. People experiencing specific combinations of memory problems, processing difficulties, and decision-making issues showed stroke rates nearly 280% higher than those with normal cognitive function. These findings have transformed how medical professionals approach stroke prevention, making cognitive assessment a critical component of early warning detection. The breakthrough came from tracking participants for months before their strokes occurred. Researchers found that cognitive changes followed predictable patterns based on which brain regions were receiving inadequate blood flow. Strokes affecting the frontal lobe created specific patterns of executive function problems, while temporal lobe strokes produced distinct memory formation difficulties. This pattern recognition allows doctors to predict not only when someone might have a stroke, but which type of stroke is most likely to occur. Confusion episodes represent one of the earliest cognitive warning signs of approaching stroke. These aren't brief moments of disorientation that everyone experiences occasionally. They're periods of genuine bewilderment lasting several minutes to hours. During these episodes, familiar environments suddenly seem foreign, routine tasks become puzzling, and simple decisions feel overwhelming. People might find themselves standing in their own kitchen, unsure of how to make coffee they've prepared thousands of times before, or feeling lost in their neighborhood despite living there for years. Memory gaps create another concerning pattern that extends beyond typical forgetfulness. These gaps involve complete inability to recall recent events, conversations, or activities that should be easily remembered, unlike normal memory lapses where you can eventually recall forgotten information. These gaps represent periods where memory formation completely failed. People might have lengthy conversations with family members and have no recollection of the discussion hours later, or complete daily activities without any memory of performing them. Information processing difficulties manifest as struggles with tasks that previously felt automatic and effortless. Reading comprehension becomes challenging, with people needing to reread sentences multiple times to understand their meaning. Following television shows or movies becomes difficult because processing visual and auditory information simultaneously feels overwhelming. Simple math calculations that were once routine now require intense concentration and often produce incorrect results despite careful effort. Decision-making problems affect both minor daily choices and more significant life decisions. People find themselves paralyzed by simple decisions like what to wear or what to eat for breakfast, spending excessive time weighing options that previously required no conscious thought. More complex decisions become impossible to navigate, with people feeling unable to analyze information and reach logical conclusions. This difficulty extends to financial decisions, medical choices, and work-related problem-solving. These cognitive changes occur because reduced brain blood flow affects different regions in predictable patterns. When blood flow to the prefrontal cortex decreases, executive functions like planning, organizing, and decision-making become impaired. Reduced circulation to the hippocampus affects memory formation and retrieval, creating the gaps and confusion that characterize early stroke warnings. Decreased blood flow to the parietal lobe disrupts spatial processing and attention, making it difficult to focus on tasks or navigate familiar environments. The temporal patterns of these cognitive changes provide crucial diagnostic information that helps medical professionals assess stroke risk. Urgency. Cognitive problems that fluctuate throughout the day often indicate that brain blood flow varies with activity levels, blood pressure changes, or medication effects. Morning cognitive difficulties suggest that overnight blood pressure dips aren't providing adequate brain circulation. Evening cognitive problems indicate that accumulated fatigue throughout the day overwhelms compromised brain regions. New digital assessments can track mental changes over time with unprecedented precision. These computerized tests measure reaction times, memory performance, processing speed, and decision-making accuracy across multiple sessions. The assessments establish baseline cognitive performance, then detect subtle changes that indicate developing stroke risk. Some tests use smartphone apps that people can complete at home, providing continuous monitoring of cognitive function over weeks and months. Normal age-related cognitive changes differ significantly from dangerous stroke-related mental decline in several key ways. Age-related changes develop gradually over years and typically affect processing speed, while leaving other cognitive abilities intact. Stroke-related cognitive changes appear over weeks to months and affect multiple cognitive domains simultaneously. Age-related changes often stabilize or improve with mental stimulation and physical exercise, while stroke-related changes continue worsening despite efforts to maintain cognitive function. The progression patterns also differ markedly between normal aging and stroke-related decline. Normal aging creates consistent, predictable changes that don't vary dramatically from day to day. Stroke-related cognitive changes fluctuate significantly, with people having good days and bad days that seem unrelated to sleep, stress, or activity levels. This variability occurs because brain blood flow changes throughout the day, affecting cognitive performance in ways that normal aging doesn't create. Cognitive rehabilitation approaches can prevent progression to severe brain damage when warning signs are recognized early. These interventions focus on maintaining and strengthening neural networks, while medical treatments address underlying circulation problems. Computer-based cognitive training programs can help preserve thinking abilities even when some brain regions receive reduced blood flow. Mental stimulation therapy encourages brain plasticity and helps maintain cognitive reserve that protects against stroke damage. Recognizing these cognitive warning signs creates the opportunity to preserve mental function through early intervention. But recognizing the signs represent the life-saving actions you must take now. Taking swift, decisive action when warning signs appear determines whether someone recovers completely or faces permanent disability. Every minute matters more than most people realize, and the specific steps you take in those critical moments can literally save a life. The updated 2025 emergency response protocols have dramatically shortened the timeframes for seeking medical attention when stroke warning signs appear. If you experience any combination of the warning signs we've discussed, blood pressure spikes with symptoms, severe headaches, vision changes, speech problems, weakness, or cognitive issues, you now have much shorter windows for optimal treatment than previously thought. When any combination of warning signs appears, your first step involves documenting exactly what's happening and when it started. Write down the time symptoms began, which specific symptoms you're experiencing, and how severe they feel on a scale from 1 to 10. Take photos or videos if symptoms involve visible changes like facial drooping or coordination problems. Record yourself speaking if you're having speech difficulties. This documentation provides emergency medical teams with crucial information that can guide their treatment decisions and help them understand which brain areas might be affected. Use your smartphone to track blood pressure readings if you have a home monitor noting the exact numbers and times. Document any medications you've taken recently, including over-the-counter drugs and supplements. Write down what you were doing when symptoms started and whether anything seemed to trigger them. This information helps medical professionals distinguish between different types of strokes and choose the most appropriate treatments. New technology makes it easier than ever to track and report symptoms to healthcare providers in real time. Smartphone apps can now connect directly to emergency medical systems, allowing you to transmit symptom information, vital signs, and even live video to emergency dispatchers and hospital teams before you arrive. Some apps use artificial intelligence to analyze your symptoms and provide immediate guidance about whether you need emergency care or can safely wait for regular medical attention. Critical questions you must ask emergency responders and healthcare providers ensure proper stroke risk assessment and appropriate care. Ask specifically whether they're evaluating you for stroke risk, not just current stroke symptoms. Request blood tests that check for clotting disorders and inflammation markers that increase stroke risk. Demand brain imaging that can detect early signs of blood vessel problems or small areas of brain damage that might not show symptoms yet. Ask about your specific stroke risk factors and which warning signs should prompt immediate return visits. Request detailed instructions about which symptoms require emergency care versus urgent care versus next-day appointments. Get specific blood pressure targets that are safe for you individually, as these vary based on age, medical history, and current medications. Different combinations of warning signs require different levels of medical urgency that can mean the difference between life and death. Immediate 911 calls become essential when you experience sudden severe headache with neck stiffness, any weakness combined with speech problems, vision loss with confusion, or severe dizziness with coordination problems. These combinations indicate that stroke may be happening right now rather than just approaching in the coming weeks. Urgent care visits within hours are appropriate for isolated symptoms like blood pressure spikes with mild headache, intermittent speech difficulties without weakness, or balance problems without other neurological symptoms. Next-day doctor appointments work for symptoms like persistent fatigue with occasional confusion, mild coordination problems, or blood pressure readings that are elevated but not extremely high. The breakthrough stroke prevention medications can stop strokes when warning signs are caught early, but only if you seek medical attention quickly enough for doctors to prescribe them. New, rapid-acting blood thinners can dissolve small clots before they cause permanent brain damage. Advanced blood pressure medications can stabilize dangerous pressure fluctuations within hours rather than days. Neuroprotective drugs can shield brain cells from damage when blood flow becomes compromised, buying time for other treatments to work. Specific lifestyle changes can immediately reduce stroke risk when warning signs appear, potentially preventing permanent brain damage within days or weeks. Reduce sodium intake to less than 1,500 milligrams per day to help control blood pressure fluctuations. Increase water intake to at least 8 glasses daily to improve blood flow and reduce clotting risk. Eliminate alcohol completely until symptoms resolve, as alcohol can worsen blood pressure problems and increase bleeding risk. Start light physical activity, like walking for 15 to 30 minutes daily to improve circulation, but avoid intense exercise that might trigger dangerous blood pressure changes. Practice stress reduction techniques, like deep breathing or meditation for at least 10 minutes twice daily to help stabilize blood pressure and reduce stroke risk. Get adequate sleep by maintaining consistent bedtimes and creating environments that promote deep, uninterrupted rest. Family members and caregivers play crucial roles in monitoring and responding to stroke warning signs in their loved ones. Learn to recognize subtle changes in speech patterns, coordination, or thinking abilities that the person experiencing them might not notice themselves. Keep detailed records of symptoms, including when they occur, how long they last, and what activities might trigger them. Practice using the FAST assessment and other stroke detection tools so you can act quickly when warning signs appear. Follow-up care and monitoring becomes essential after experiencing any stroke warning signs, even if symptoms completely resolve on their own. Schedule comprehensive stroke risk assessments that include advanced brain imaging, detailed blood work, and specialized testing for clotting disorders. Establish regular monitoring schedules for blood pressure, cholesterol levels, and other stroke risk factors that may have contributed to the warning signs. Work with healthcare providers to develop personalized stroke prevention plans that address your specific risk factors and warning sign patterns. The key is treating warning signs as serious medical events that require ongoing attention rather than isolated incidents that can be safely ignored once they resolve. But taking action when warning signs appear represents only one part of the equation. The real breakthrough comes from understanding how modern medicine has revolutionized our ability to prevent strokes before they ever occur. Prevention strategies that actually work in 2025. Stroke prevention in 2025 offers more powerful tools than ever before, but these life-saving advances only work when you know about them and put them into practice. The American Heart Association's latest research confirms that up to 80% of strokes can be prevented using methods available right now. Yet, stroke rates continue climbing because people don't know these breakthrough prevention tools exist. The latest 2025 research has produced game-changing advances in 3 critical areas that can dramatically reduce your stroke risk. New medications can now reverse arterial damage that doctors previously considered permanent and irreversible. Lifestyle interventions based on massive longitudinal studies have identified specific daily habits that provide protection far beyond what anyone thought possible just 5 years ago. Monitoring technologies can detect stroke risk months before symptoms appear, giving you unprecedented time to take preventive action. These advances work because they target the root causes of stroke rather than just treating symptoms after damage has already occurred. Previous prevention approaches focused mainly on managing blood pressure and cholesterol after they became problematic. The 2025 methods identify and address the cellular and genetic factors that cause these problems in the first place, stopping the stroke process before it can begin. Daily habits proven most effective at preventing strokes have been completely redefined by longitudinal studies that followed over 500,000 people for more than a decade. The research revealed that timing, intensity, and specific combinations of activities matter far more than anyone previously understood. Morning exercise performed within the first hour of waking provides 340% better stroke protection than the same exercise performed later in the day. This happens because early morning activity helps regulate the dangerous blood pressure surges that occur naturally when you wake up. Hydration timing has emerged as a critical prevention factor that most people completely ignore. Drinking 16 ounces of water immediately upon waking, followed by 8 ounces every 2 hours throughout the day, reduces stroke risk by 23% compared to drinking the same total amount of water at random times. The specific timing helps maintain optimal blood viscosity throughout the day, preventing the dangerous thickening that can trigger clot formation. Sleep architecture optimization goes far beyond simply getting 8 hours of rest each night. The 2025 studies show that sleep timing, room temperature, and pre-sleep activities affect stroke risk as much as sleep duration itself. Going to bed within the same 30-minute window every night reduces stroke risk by 18%. Maintaining bedroom temperatures between 65 and 68 degrees Fahrenheit improves deep sleep quality enough to provide measurable stroke protection. Avoiding screens for 90 minutes before bedtime helps regulate hormones that control blood pressure during sleep. Genetic testing available in 2025 can identify people at highest stroke risk by analyzing 127 different genetic variants that affect blood clotting, arterial health, and blood pressure regulation. This testing goes far beyond the basic genetic screening available just a few years ago. The new panels can predict not only your overall stroke risk, but which specific type of stroke you're most likely to experience, and when in your life your risk becomes highest. The genetic information enables personalized prevention strategies that are tailored to your individual risk profile, rather than using generic approaches that work for the average person. People with certain genetic variants benefit dramatically from specific medications that provide little benefit to others. Some genetic profiles indicate that particular dietary changes can reduce stroke risk by up to 60%, while the same dietary changes provide minimal benefit to people with different genetic makeups. Breakthrough treatments available in 2025 can actually reverse some stroke risk factors that medical professionals previously considered permanent and unchangeable. Advanced chelation therapies can remove arterial plaque that has built up over decades, essentially turning back the clock on arterial aging. New regenerative treatments can repair damaged blood vessel walls, restoring normal elasticity and function to arteries that had become stiff and narrow. Blood tests developed in 2025 can detect stroke risk months in advance by measuring biomarkers that indicate arterial inflammation, clotting tendency, and blood vessel dysfunction long before traditional risk factors become abnormal. These tests measure proteins released by struggling blood vessel walls, inflammatory markers that predict arterial damage, and genetic material that indicates accelerated cellular aging in the cardiovascular system. The tests can identify people at high stroke risk even when their blood pressure, cholesterol, and other traditional measurements appear completely normal. Dietary and exercise protocols that showed the greatest success in stroke prevention during 2025 studies focus on specific nutrient timing and exercise intensity patterns rather than general healthy eating and activity recommendations. The Mediterranean intervention for neurodegenerative delay diet, when combined with intermittent fasting protocols, reduced stroke risk by 42% in study participants. This approach emphasizes consuming anti-inflammatory foods during specific time windows that optimize their protective effects. High-intensity interval training performed 3 times per week provides superior stroke protection compared to longer sessions of moderate exercise. The specific protocol involves 30-second bursts of intense activity followed by 90-second recovery periods, repeated for 15 minutes total. This pattern improves arterial function and blood flow more effectively than traditional steady-state exercise routines. Wearable technology available in 2025 continuously monitors stroke risk factors and provides real-time alerts when dangerous patterns are detected. These devices track blood pressure variability, heart rate patterns, sleep quality, physical activity levels, and even speech patterns to identify combinations of changes that predict increased stroke risk. The devices connect to smartphone apps that analyze this data using artificial intelligence algorithms trained on millions of health records. The most important prevention strategy that could eliminate up to 80% of strokes involves comprehensive blood pressure management that goes far beyond simply taking medication when readings become high. Nearly half of American adults have high blood pressure, and many don't realize it because they only check their pressure occasionally at doctor visits. Continuous monitoring reveals the blood pressure fluctuations and patterns that predict stroke risk weeks in advance, enabling interventions that can prevent permanent arterial damage and stroke occurrence. All these prevention advances create unprecedented opportunities to protect yourself and your loved ones from stroke, but only when combined with immediate recognition and response to warning signs when they appear. The power to prevent stroke lies entirely in your hands when you understand what your body is telling you. Every warning sign we've covered today, from blood pressure spikes and unexplained exhaustion to vision changes, dangerous headaches, muscle weakness, speech problems, balance issues, and cognitive changes, represents your body giving you precious weeks to prevent permanent brain damage. These symptoms aren't random occurrences to dismiss or ignore. They're your brain's emergency alert system working exactly as designed, providing the time you need to seek medical attention and begin life-saving treatments. Share this information with family members, friends, and co-workers because someone you care about might be experiencing these warning signs right now without understanding their significance. Schedule your comprehensive stroke risk assessment this week, not next month. The prevention tools and treatments available in 2025 can protect you, but only when you recognize the warnings and act